Frances Martel is the national editor of Breitbart News, the main conservative news media in the United States. Frances is the national editor, and she carefully monitors international events and reports on them for Breitbart. She has given exceptional coverage to China and the coronavirus from the very beginning of this crisis. Frances, hi, and thank you for being on our program.
Absolutely. Thanks so much for inviting me.
Frances, what can we say about the origins of the coronavirus and how the Chinese model contributed to its rapid spread?
Well, we know that the virus originated in Wuhan, China. No matter what Beijing has said, all medical experts around the world agree that it originated in Wuhan, China, which is in the heart of the country. We don't know exactly where it came from, but we know that the first case of coronavirus, of this novel coronavirus, was diagnosed on November 17th, 2019. We know that the Chinese Communist Party alerted the world, made public the discovery of this virus on January 20th. So between November 17, 2019 and January 20th, 2020, the Chinese Communist Party allowed people in Wuhan, which is a city of 11 million people, to live their lives normally, and not only that, but hosted mass events. They hosted a banquet for Lunar New Year in which 130,000 people were sharing food. So they actively exacerbated the outbreak, and they've turned it into a pandemic. And what we know so far is that it tends to hit children pretty mildly. Adults, young adults, it can vary, but the death toll is much lower. And then older adults, middle-aged and older adults, and people with pre-existing conditions can suffer pneumonia and death if they're exposed to it.
Like diabetes.
Exactly. Diabetes, asthma, any sort of cancer, especially HIV, of course, any condition that weakens the immune system, it can make the coronavirus much deadlier.
The People's Republic of China authorities tried to use censorship at first to control news about the virus?
Yes, so while the Communist Party was feeding 130,000 people, by the way, older people, because this was a banquet for parents whose children were abroad and couldn't celebrate with them, while it was actively spreading the disease, there were doctors in Wuhan who were trying to convince Chinese residents to wash their hands, to stay indoors, to enact social distancing. Exactly what we're being told today was being told to the people of Wuhan on social media in January. And the doctors who said that were arrested. They were humiliated. There was the case of Dr. Li Wenliang specifically, who died at age 34 of coronavirus after being arrested. We don't know what happened to him when he was behind police doors, but we know that he signed a statement saying that he had disturbed public order and that he was extremely sorry for all the harm he had caused the Communist Party and the People's Republic. And all he had done was tell other doctors in a group, in a WeChat group, which is a Chinese social media medium, to wash their hands and to be careful because this is a contagious disease.
How will coronavirus change globalization? Is it too early to tell?
Well, I think we know what the conversations are going to be. We might not know what the world will look like. We can have an idea of what the world will not look like, and that is what it looks like today, where China is the world's factory, where even things that are manufactured abroad in the United States and other countries, the bits and pieces that we use to build those things are made in China. So the entire global economy is now held hostage by the Chinese Communist Party. I think as a human race, we have all agreed that this is bad now. It took way more harm than really needed to be caused for this. And there were many other reasons for why we should have questioned this. For example, the 1 to 3 million Uyghur Muslims who are in concentration camps right now, many of which have been shipped to factories where the Han Chinese can no longer work because of coronavirus, so they're willing to sacrifice the Uyghur Muslims to continue building things. That horror, that moral horror should have been enough to distance us. It wasn't. Now we have a pandemic, and hopefully that will be enough. So I think we'll see the end of that. I think institutions like the United Nations, the World Health Organization, the European Union, the African Union, all of these things we built specifically to protect us from exactly what is happening now, their failure is going to lead to significant changes in how the global global governments are structured and in how we address emergencies, because we can't leave the status quo as it is. It obviously failed. We have over 100,000 cases of this. We have thousands dead, and we have no idea how this is going to end.
Isn't it ironic that so little attention has been paid to how effectively Taiwan has dealt with a crisis? In other words, all the attention has been on the spin about China and its relationship to coronavirus, but very little attention to Taiwan probably being the most successful country in the world in dealing with it.
Yeah, well, as you say, it's the most successful country, and we can't even agree on the fact that it is a country because China bullies every international institution into denying the obvious fact that this is a country. And I say obvious because it has a president, it has democratic institutions, it has a military, it has every structure that a government is defined as having, and China insists on calling it a province. It insists on keeping it out of the World Health Organization and the Civil Aviation Organization, the United Nations. So the one country that was blocked from all of the world institutions created to protect us from this pandemic is the one doing the best. And I would argue that that's because they're not part of the World Health Organization, because they're not part of the UN. They enacted their sovereignty in order to protect themselves. And they were quick to say in January, there are rumors of this mystery pneumonia killing people in China. We're going to shut the borders. We're going to start monitoring people coming in from China. We're going to treat this like it's a pandemic early because we don't trust a word of what the Chinese government says. If they had been part of the World Health Organization, they would have been sternly criticized for that. It's possible that their president and their officials would have not taken these emergency actions because they would have been pressured to not do so because they embarrassed China. When you do something to protect yourself from China, you're telling the world that China is a threat. And so the entire Chinese government apparatus is designed to stop people from doing that. I mean, we can't even call this the Wuhan virus. We have to call it SARS-CoV-2 or COVID-19. Anything that does not say China, that's what we call it. So I think we're ignoring a big reason that people who believe in globalization are ignoring the Taiwan success story is that it disproves the need for any of these institutions and goes beyond it. It shows that having those institutions is actually a threat to our health and to the national security of the countries that participate in it.
What about the future of the European Union? How do you see that?
Well, I can't imagine that countries within it who are getting zero help from their fellow countries want to continue being part of it. I mean, there are Serbian officials that came out today saying that the EU is a joke, that they feel completely isolated because no one is helping them get the medical supplies they need, is not helping them contain and participate in this social distancing that we have to do to keep the virus from hurting us. I think there are a lot of questions. Italy, arguably the most damaged country among the EU countries for participating in the EU. A few years back when we had the big waves of migrants from Syria and from Libya, Italy was taking most of those migrants, and they desperately reached out to Germany, to France, to the rich EU countries asking for help to take these people in. I mean, that's part of the point of the EU, is that you can share the burden of emergencies, and no one listened. Everyone ignored Italy's pleas, and that's severely hurt Italy's government infrastructure. And that's another question we could ask. If Germany and France and the other EU countries had helped Italy when they really needed it during the migrant crisis, would Italy be in a better position to deal with the pandemic today? We can't say for sure. Italy has universal health care, so it was always going to be rough sledding for them. But I think every time there's an emergency and the EU fails to help the countries most in need, that raises a lot of questions. And I think it helps nationalists and people who want to empower the sovereignty of countries make their case.
What did coronavirus reveal about the universal healthcare system of Italy?
Well, that it doesn't work. Not just because they don't have enough supplies, they don't have enough doctors because people are dying, but because of the horror we're seeing where doctors have to pick who lives and who dies, because the government has supreme power over this, and there's no incentive from the free market, right? Or incentive to make money or to create things that people want, like vaccines or ventilators. So you have a limited supply of these things, and the government has to make these callous decisions. You know, who among these people benefits the government best if they stay alive? And if you're not one of those people, you're told to go home and die. And that's usually senior citizens, people, again, with pre-existing conditions that have a lower shot of surviving the virus anyway. But when you have a system that's privately based and you have private competition, you have more than one option. You don't just go to the government and ask for help and hope for the best. You can go to different places. You can see who is willing to give you a shot as a patient. And that's sorely lacking in Italy right now. And you know, we have to feel really bad for the doctors who went into this because they want to save lives, and the government is telling them, no, you have to choose who dies. You don't choose who gets treated. You choose who doesn't get treated. And I think that's unavoidable when you have the government controlling the healthcare system.
Frances, thank you so much for this enlightening analysis of the situation.
Thank you so much for having me.
All right, thanks.